Good day everyone, I am Aryan Jiling Barba and today I'm going to do the shampooing to the patient. So the purpose of shampooing is for personal hygiene of the patient and to provide patients comfort and relaxations, then to keep or preserve the patient's conditions of hair or the good conditions of the patient's hair and to avoid the spreading of microorganisms. So before proceeding to the right procedure of shampooing, we must follow the 12 sequence. So first, always read the patient's chart, know the patient's diagnosis and status, and always read the doctor's order. Then, go to the room, knock the door, and introduce yourself. So, good afternoon, ma'am. I am Aryan Jiling Barba, your caregiver for today. And may I know your name, ma'am?
Yes.
Okay, I'm serious. So, when is your birthday, ma'am?
August 24.
How old are you, ma'am?
18.
So, secondly, check the rest tab. So, okay. So, now, ma'am, I'm going to shampoo your hair or do the shampooing for you to feel comfortable and relaxed and for your personal hygiene as well. Then, to prevent the spreading of microorganisms and help you to preserve your good conditions of hair. Now, we're going to check the patient's vital signs. So, ma'am, I'm going to check your vital signs. So, the vital signs of the patient is normal and now we're going to ask permission to the patient. So, ma'am, I ask permission to leave and go to the stations and prepare the materials and tools needed.
Yes.
Okay, ma'am. So, thank you. But before leaving to the patient's room, make sure to raise the side rails and lock. Then, raise the side rails and lock to avoid any form of accidents to the patient. So, I'm done preparing the materials and tools needed in shampooing and I'm done preparing myself. I'm done doing the proper hand hygiene. So, now let's proceed to the patient's room. Then, back to the patient's room, knock the door, then, hello ma'am, I'm back. So, now we're going to provide patient's privacy by draping the curtain and locking the door. Then, ask the patients if you want to defecate or urinate. So, ma'am, do you want to defecate or urinate? Okay ma'am, so let's proceed in shampooing. So, now the patient is diagonal on bed and I'm done putting the bath blanket to the patient's chest. So, now we're going to put the bath towel to the knuckle area of the patient. So, let the patient to avoid the wetting and to hyperextend the head of the patient. Then, comb the hair of the patient gently from scalp down to the edge of the hair of the patient. So, the patient's hair is quite long, so we're going to lift the patient's hair and comb the edge gently to remove the tangles of the hair. Then, after combing the hair of the patient, put a slightly moist towel to the eyes of the patients to protect the patients from the glaring of the lights and to feel to the patient's comfort and relaxation. And then, put a dry cotton balls to the ear of the patients to avoid the accidental entering of the water to the ears of the patient. So, now we're going to wash the hair of the patient from the scalp down to the edge of the hair. Then, at the back of the hair. Then, the patient's hair is quite long, so we're going to dip it the dipper with water in order to wash the patient's hair thoroughly. While washing the hair, always remember to massage the scalp of the patient using your fingertips, including the back. So now we're going to ask the patient's preferences for what shampoo she wants. So what shampoo did you want, ma'am?
Sunsilk.
Okay, so Sunsilk. So now we're going to apply shampoo to the hair of the patient. So apply starting to the scalp of the patient. Massage it gently. So since the hair of the patient is quite long, use a dipper, put it with water and shampoo. Then soak the shampoo and soak the edge of the hair of the patient So, like this. Then, after soaking the hair or after applying the shampoo, massage thoroughly. So, now, massage the hair of the patient's scalp down to the back of the patient's hair. Then, to the edge. After applying the soap, rinse the hair of the patient, starting from the scalp, massage, then to the back of the patient, then lift the hair and dip it to the dipper so that we can rinse the patient's hair gently. So, rinse the patient's hair if necessary, if there's a lot of bubbles. So, now we're going to remove the slightly moist towel to the eyes of the patient and use it to clean the forehead of the patient. So, then, the cotton balls to the hair of the patient. So, after rinsing the hair of the patient, you can pat dry the hair of the patient. So, in patting dry the hair of the patient, you can use a blower. If the blower is not available, you can use a towel and patting dry. So, put it to the knuckle area of the patient. Then, wrap the hair of the patient. And then, pat dry, starting from the scalp, then to the back, and to the edge of the hair of the patient. Then, after patting dry, discard the towel and comb the hair of the patient from the scalp, then to the back. And the patient's hair is quite long, so we're going to lift the patient's hair and comb the edge gently. So, after combing the hair of the patient, and now we're going to remove all the materials that we use. After the shampooing procedure, the patient now is in the supine position. So, ma'am, how was my shampooing to you? How did you feel?
It's okay.
Do you feel comfortable, ma'am?
Yeah.
Okay, ma'am. Thank you. After asking the patient if she's comfortable, then check her vital signs. So, the patient is comfortable and relaxed na, and that's all.